What does retroperitoneal mean for the pancreas? Imagine the inside of your abdomen as a busy highway with many different organs traveling in their own lanes. The pancreas is like a hidden station tucked away behind the scenes, and knowing exactly where it sits is important for understanding its health. When we say the pancreas is retroperitoneal, we mean it is located behind the lining of the abdominal cavity called the peritoneum. This lining is like a thin, protective sheet that covers many organs, but the pancreas lies behind it, in what's called the retroperitoneal space. Specifically, the pancreas sits in the anterior part of the retroperitoneal space, which is just in front of the kidneys and the large blood vessels like the aorta and the inferior vena cava. The head, neck, and main body of the pancreas are all in this space, nestled close to major arteries and veins that supply blood to the abdomen and legs. The tail of the pancreas, however, is a bit different. It extends into a ligament called the splenoidal ligament and is considered partially intraperitoneal, meaning it is more surrounded by the peritoneal lining. This position makes the pancreas less mobile than organs that are fully within the peritoneal cavity, like the stomach or intestines. Because it is fixed behind the peritoneum, any disease affecting the pancreas, such as tumors or inflammation, can directly involve nearby structures like blood vessels or the kidneys. This close relationship is important because it can influence how pancreatic diseases develop and how they are treated. When it comes to health issues like pancreatic cancer, the retroperitoneal location can sometimes delay symptoms. Since the pancreas is behind the peritoneal lining, early signs of disease may not cause noticeable pain or discomfort. This can make early diagnosis challenging, often leading to detection only after the disease has advanced. Imaging techniques such as CT scans or MRIs are especially useful because they can visualize the pancreas in its retroperitoneal setting and show how a tumor might be pressing on or invading nearby structures. Understanding the embryological development of the pancreas adds another layer to this. During early development, the pancreas forms within the peritoneal cavity but then migrates behind the peritoneum as it matures. This process explains why the head, neck, and body are retroperitoneal, while the tail remains more within the peritoneal cavity. In summary, when we say the pancreas is retroperitoneal, we are describing its position behind the lining of the abdominal cavity, fixed in place and closely related to vital blood vessels and organs. This location influences how pancreatic diseases behave, how symptoms appear, and how doctors approach diagnosis and treatment. If you have concerns about pancreatic health or are experiencing symptoms, it's always best to consult with a healthcare professional who can provide personalized advice based on your unique situation.